Good morning, everyone, and welcome to this session. So I'll be talking on the revolutionizing health policy dialogue through a thinking together approach, insights from the health economics policy engagement think tank in Malawi. I think most of us yesterday attended the Science Cafe. There was a heated discussion on how evidence from research actually find its way to the policymakers. I happened to also attend a session on neonatal morbidity and mortality in Malawi. There was also a panel discussion related to the same. So with the quest of achieving universal health coverage and also achieving national goals, there is a quest of evidence that is going to influence policy decisions. And then with this, there's a rush to policymakers from researchers to present their evidence that is going to shape these decisions. However, this approach to meet and reach decision makers is not coordinated, is fragmented, and is done in silos. Because of this, sometimes information that is reaching the policymakers is not what really they want. If I have to borrow Professor Mfuso Bengo's words, is that evidence of presence of information that policymakers want is not actually evidence. I mean, presence of evidence is not evidence of presence. So even if there's evidence that information is there, but you find that that information that is present does not actually reach the people that want it at an optimal time. And therefore, realizing this, there was a way of how this could be addressed. And in 2018, the Minister of Health, the Chancellor Onse, as well as the HEPE, came up with a platform which they call the HEPE. And since then, there have been 16 sessions that have been conducted under this platform, and the 17th one is being scheduled in a few weeks to come. So the main objectives are that it's aimed at establishing a coordinated and inclusive engagement platform for policymakers, researchers, and partners to deliberate issues that could inform policy and how this evidence could be generated, and there should be a coordinated way on relevant issues. And at the same time, to promote the thinking together between the researchers, the policymakers, and the community that are going to benefit from these policy decisions that are going to be made. And in addition to that, they want to identify, I think, areas that need evidence generation through the policy labs, which is a parallel platform to a think tank. And then also to ensure timely uptake of this evidence by policymakers, also to provide contextualized solutions that really answers problems that are on the ground, as well as strengthening the platform where policy decisions that are evidence-based are going to be formulated. And how is this done? How is the agenda for these think tanks set? So as we can see, it's cyclic. So the ministry or the policymakers identify areas that need evidence. And this is done together in a policy lab, together with the researchers and the beneficiaries of the policy decisions that are going to be made. And then later on, the policy labs generate this evidence, and then a think tank is convened. And once this evidence has been presented at the think tank, what happens later on is that sometimes this evidence could be adopted and inform the policies, or sometimes it could be appended, or maybe even further evidence gaps could be identified, and then it goes back to policy lab for further research. There are three main types of think tanks. The first one is the normal think tank that happens within the national boundaries. Mostly the local researchers actually generate evidence that inform policy. But sometimes there are issues that are beyond the borders of Malawi that need to be addressed. For example, the COVID, which also requires other researchers and policy labs beyond the bounds of Malawi, which can actually inform policy decisions that are not only affecting the country, but also regional as well as global decision making. And sometimes there could be extraordinary think tanks that are actually also tabled under this. So these are mostly done on demand basis because there could be emergencies that could erupt in a country, and these are platforms that could be used to respond to such issues. But what's very unique about the HEPE think tank, there have been classical think tanks that are there, and there are also think tanks globally. But what's quite unique with ours is that it's a hybrid. While other think tanks are quite academic and independent, the HEPE think tank is comprised of the policymakers, the academia, as well as the partners, and also the beneficiaries, the community, the CSOs that are actually representation of the policy decisions that are going to be made. In addition to that, the uniqueness of the HEPE think tank is that in terms of the stakeholder and the participants. So it includes everyone, because the thinking is that it should be inclusive. All the people that are affected should be part of the decision-making and evidence generation to actually promote ownership. And then the evidence that is generated gets directly into policy when it's adopted. And you have to know that there are actually, these activities are done at quarterly basis, and there are 3 types of national think tanks, but we have only one international think tank. But extraordinary think tanks can be done depending on demand. So far, the think tank has actually generated very important policy decisions that have been made. The first one is that we have created a platform for an open policy engagement between researchers and policy decision makers, as well as the beneficiaries, the community, the CSOs. The other one, quite prominent, is during the COVID period, you find that the think tank, the extraordinary think tank, was actually convened to look at the dosage speciation, as well as governance and guidance, as well as issues on equity. There is a paper that was published on equity on accessing the COVID-19 vaccine. And another achievement out of this is that there was actually a discussion that informed the HSP 3. Additionally, from the same platforms, there has been the Tansi O disease and O system model that has been also as one of the things that was discussed in this. And we have also looked at the directly facility financing and the CHAM SLA analysis. My colleague is going to come to talk a bit more on the direct facility financing. So we also have an HTA as part of the issues that have come out as one of the achievements in the think tank. And for your information, HTA institutionalization has actually occurred, and the MOH has adopted this. We are in the process of establishing a unit in the ministry. And another achievement out of this think tank is that the health sector joint fund evaluation that actually was part of what was presented at the think tank, and how this demonstrated that pooled funding could actually help in the situations of, say, limited funds and out of the situation we had on Cashgate. And the final one is on the sustainability of HIV services post-withdrawal of US government. So out of the work that has been done, there is recognition that we've gained in the region. The EXA wants to replicate similar kind of platforms in the region, and also recognition from the University of Oxford, as well as trying to find a platform where some kind of information or evidence that we're generating as researchers could now be opened so that the policymakers find it. What are the major challenges that we've gotten? Mostly it's been the funding, and also most people haven't really known this platform, and that's why it's being presented here, so that a few more policy labs are included in this platform for evidence generation. So with this and sustainability, there was an issue of sustainability in one of the presentations that I watched and the panel discussion that I attended earlier on. So there's need to scale up this and at the same time to have a dedicated budget for this and include even more policy labs that could generate more evidence that the policymakers need, but in a coordinated and thinking together approach. And also to create a platform where other settings in the region and globally can benchmark from. Reaching this juncture, I think I should say thanks so much to all the colleagues and the funders. Thanks so much.